Hi, everyone. My name is Lynn Voss from GoldenCare. I have been here for about 16 years as a marketing support person, supporting our regional directors, John and Jeff, in their initiatives. I'm coming up on 16 years here with GoldenCare, so I've been in a support position, doing everything from running quotes to answering product questions, helping with education, supply order forms, sending hard copies, you name it. I've been helping, um, with the education on our products. And we've actually been moving more toward the short term care policies, and one of which is the new essential care short term care policies from Medico, a Wellabe company. So I have the pleasure today of introducing Courtney Mayer from Wellabe. She has been there for 12 years. And if I'm not mistaken, Courtney, I believe you've done a similar job to what I have, in terms of wearing multiple hats. So,
Yes, yes, that is correct. I actually just celebrated my 13th anniversary last week, and I've done a little bit of every department. I spent most of my time on the agent service line, and then the last 4 years I've been on the sales team here.
good deal. Good deal. So, thank you very, very much for taking time today to come on for this training as our special guest. I'm excited to learn a little bit more and share these details with our agents. So, I really appreciate you coming on.
Yes, well, thank you for having me today. First of all, we are very excited about our newest product that we just brought back in August. We launched it, right before AEP hit. So now we're really, hitting the field with it, but we're extremely excited to offer the short-term care insurance. Now, just so everybody knows, I will send these slides over to Lynn when we're done here. So if you want a copy of them, we will definitely make sure that you get a copy of those slides here. Now, before we get into the product itself, we kind of just want to go over a little bit why Wellabe, because most of you may still be used to saying Medico, and I am too, but we are Medico, a Wellabe company. So we have been around since 1929. We are a financially strong and stable organization. We have an A rating with AM Best, which is an excellent rating. And the Wellabe comes from, just to kind of give you a background of the Wellabe and the name change behind that, is that we will always be here. Those interlocking L's you will see throughout the presentation, we just want you to know that we will always be here for you, the clients, and the well-being of our clients as well. Now, let's get into why we are all here today. What about Wellabe's short-term care? So short-term care insurance not only helps your clients maintain an active lifestyle while aging in place, but also makes sure their retirement savings are well protected, they can do more, worry less, and make every day better. According to the Administration for Community Living, someone turning age 65 today has almost a 70% chance of needing some type of long-term care services and supports in their remaining years. On average, 42% of people need less than 1 year of at-home paid care, and 37% of people need less than 1 year of any skilled care in a facility. When one healthcare situation leads to in-home or skilled nursing assistance, it can quickly deplete funds. Extended care is expensive, as we all know, and costs can add up quickly. Here's a look at the estimated national average cost in 2023, according to the U.S. Department of Health and Human Services. On average, an American turning 65 years old today will incur about $121,000 in future extended care costs, measured in today's dollars. Families will pay more than 1/3, about 37% of the cost themselves out of pocket, with the rest covered by public programs and private insurance. Now, Medicare Part A and B cover some home health services and inpatient skilled nursing facility care after a 3-day minimum medically necessary inpatient hospital stay, but they don't cover long-term custodial care. Part A copays and the Part B deductible usually apply, which could mean steep out-of-pocket costs for clients. Short-term care insurance can help cover these gaps. It can also help clients who cannot qualify or afford long-term care insurance. Short-term care insurance has fewer restrictions for qualifications and types of care it covers. It's commonly less expensive than long-term care insurance, and it provides immediate benefits after the elimination period. Considering many individuals with long-term care insurance only need care for less than a year, short-term care insurance just makes sense. It also makes sense to plan early for extended care needs that may appear during retirement. Clients who are age 40 years or older are eligible for Wellabe short-term care insurance. Now, Wellabe short-term care plan is a product that offers coverage for extended care at home or in a facility, and we'll go through the benefits here in the next couple of slides. It covers both medical and non-medical care. It's an indemnity-based plan, not a reimbursement. So the full benefit is paid out per day, no matter what service is received. The plan options are reflective based upon how clients are going to answer the 11 health questions on the application. So here's the Essential Care Plus. So I'm going to break down each one of these two. So, this is if the client can answer no to all health questions on the application, then they can qualify for the Essential Care Plus plan level. It's a standard, fully underwritten plan that gives clients the option to select a daily benefit up to $300 a day for 360 days of in-home health care, and then they can select either a 0 or a 20-day elimination period. Benefits can be restored one time if the insured fully recovers from the qualified event and does not need care for 180 days. Clients can also elect up to a $500 per day, up to 360 days for a separate facility care rider. And again, we'll talk about that in a few more slides. Now, here's just an example of some of the questions that are going to be asked on that application. So are they currently receiving care for assistance with the 6 activities of daily living or cognitive impairment? Within the past 6 months, needed mobility assistance or oxygen? Within the last 6 months, been confined to a facility or utilized home health care? Within the last 24 months, been diagnosed or treated for a nervous system or memory loss disorder? Within the past 24 months, been diagnosed or treated for motor neuron disease, an amputation of a limb? Within the last 24 months, been diagnosed or treated for diabetes requiring insulin or in combination with heart or kidney disease? In the last 24 months, been diagnosed or treated for internal cancer? Within the last 24 months, been diagnosed or treated for kidney, lung, or liver disease? In the last 24 months, been diagnosed or treated for heart disease or osteoporosis or fracture bones? Within the past 10 years, been diagnosed or treated for AIDS or HIV? So we are asking, some of those big questions on the application, but if they can answer no to all of those questions, then they could qualify for this plan, the Essential Care Plus. But now, say you have a client that can answer no to the first 6 questions on the application, but maybe they answer yes to any of the remaining questions. They can qualify for the Essential Care Plan level. This plan has less restrictive underwriting, and it covers a daily benefit up to $150 a day for 360 days of in-home health care with a 20-day elimination period. Clients can also elect up to a $250 per day for up to 360 days for that separate facility care rider that we'll talk about here in a few more slides. Now, say you have someone that answers no to the first question, but they answer yes to questions 2 through 6 on that application. But they apply with another applicant that qualifies for Essential Care or the Essential Care Plus plan, then they can qualify for the limited benefit rider. This rider gives clients the option to select a daily benefit up to $100 a day for up to 180 days of in-home health care with a 90-day elimination period. Now, some of the other plan highlights that we have. All essential care plan levels feature a household improvement. It's a $500 benefit that is paid at policy level from home modifications that help the insured remain at home. Household improvements include, but it's not limited to, maybe installing ramps, widening doorways or hallways, or modifying a bathroom. There's also a care coordination of $500 benefit. This is also paid at policy level for help setting up a care plan when that need arises. Those who qualify for the limited benefit rider are also eligible for these benefits as well. Now, let's take a look at the optional riders, which help you create a personalized healthcare package to meet your client's needs. So we're going to talk about the nursing facility care rider benefit, the nursing facility care benefit first. This allows clients to elect a daily benefit up to $500 per day for up to 360 additional days of care in a facility with an elimination period of either 0 or 20. The rider also includes a 21-day bed reservation benefit that pays the daily amount to hold a care facility room during a hospital stay. The benefit is also eligible for a one-time restoration of benefit if the insured fully recovers and doesn't receive care for 180 days. The inflation protection benefit, the clients can add inflation protection to the base home health care benefit or the nursing facility care benefit. The inflation protection benefit increases the daily benefit amount by 5% of the original daily benefit on each policy anniversary. Now we're going to go on to the adult daycare rider. This is going to pay $50 per visit for up to 20 visits in an adult daycare setting. The benefit is also eligible for a one-time restoration of benefit if the insured fully recovers and doesn't receive care for 180 days. Now, the return of premium rider. So the return of premium rider allows a portion of the premium to be returned if the policy is terminated. How it works is it's a graded benefit based on the duration of the policy. So after 10 years, 25% of premium is returned. 15 years, 35% of premium is returned. And after 20 years, 50% of premium is returned. The payout is, of course, minus any claims paid at time of termination. Now, on this slide here, it is going to show you all of the different variations that are available to clients. Now, the best way, the easiest way to quote this is going to be my enroller. That is going to also give you the health questions. So once you are answering those questions, if they answer yes to one of those questions that we had talked about, it is going to know what policy that they would be eligible for. So again, this just breaks it down to show what the essential care plus, the essential care, and the limited benefit rider, what all is available to your clients when they are selecting these plans to truly help fit their needs. Maybe they're trying to stay within a certain budget. You can really tailor all of these to help really personalize their policy for them. Now, couples who apply together stay together. So spouses or any two people that are in the same household who are age 40 years are eligible for a 7% discount. They can double their discount to 14% if both apply and are issued a Wellabe short-term care insurance policy. If a policy is issued with a limited benefit rider, then they are going to get a 5% household discount for that. And if they also apply for, and they already have a Medicare supplement policy with any of the Wellabe companies, they are going to be eligible for a 5% multi-policy discount for that. We are always looking to try to add discounts when and where we can for all of our policies. Now, this next slide right now, it's not going to look too impressive. So right now, this is the 10 states where we have this product available at. But I can tell you, we are getting ready to launch 14 more states. We are just waiting for all of those approvals to come through. So by end of Q1, we are going to have, hopefully, what I'm being told is we will have 14 more states added to this. So our goal is to eventually have this product in as many states as we possibly can. So just keep an eye out for that. I will definitely let Lynn know when we are launching new states, so that way they can communicate that out to you as well. Now, short-term care insurance can be sold to your clients anytime throughout the year. Short-term care is a strong standalone insurance, but it can also complement other types of insurance you sell. If you sell products in any of these categories, you should consider offering your clients our short-term care product. As we had kind of talked about before, they fit very well with any other policy because people are wanting to stay at home. We learned that from COVID, people are wanting to stay at home as long as they possibly can. Now, I'd kind of already talked about My Enroller a little bit here, but My Enroller is going to be where you can quote this product. You're actually going to be able to send a quote as well. So if you're talking to somebody, you want to email them a quote, you can do that. And it's going to also send a copy of the brochure. So if you're doing the short-term care, it'll send them the quote, it's going to send them the copy of the brochure, and it's going to send them your information as the agent. You can use My Enroller on pretty much any kind of computer, laptop, tablets. You just have to be connected to Wi-Fi when you are submitting the applications. And again, when you are quoting the short-term care product, just because the plans are based upon how they answer those questions, it will tell you right then and there if they answer yes to a certain question, what plan they are going to be eligible for. Now, we have a number of tools out on our agent website for this particular product. So if you go to the agent website, which is wellabe.com/sign-in, we have client materials. We actually have PowerPoints and brochures and highlight sheets of this product and all of our products as well. So you can go out there and get the consumer PowerPoint presentation. It's already been approved by our compliance and our marketing team. So if you are sitting down with somebody and you would like to have something like that to kind of go over, we definitely have that out on the website for you to go utilize and all of the tools out there. Now we also have for our consumers, so if you sell them a policy and they become an active policyholder with us, they will have access to our consumer resource as well. This is going to be an app that they can download. It's the Wellabe Be Well app. They can get their ID cards. They can view plan coverage details. They can submit claims. Find a provider that does not apply to the short-term care, but if they have a dental plan. So this is a great app that gives your clients access. They can access their policy at their fingertips anytime that they wanted to. They can always, of course, call in, but we've learned that they like to use the app so they can get what they need right from there. Now, our incentives that we have going on right now. So we have an incentive for all of our products. But the short-term care, the one that we just talked about, it started January 1st and it's going to run through March 31st. How it works is submit 3 qualifying short-term care applications and you're going to get $150 for that. And what is nice is we retro back. So once that 3rd application comes through and is approved, we will go back and start paying you on that very first application that was submitted into us. So that is the incentive that we have for the short-term care going on right now. That goes until March. I'm assuming that we're probably going to have incentives for it as we go on throughout the year as well, but that's what we have right now for that. And now, Lynn, that's kind of what I have here for our short-term care. Let me see here. So, I'm sorry, there's my last slide. If you guys have questions, like I said, I will send Lynn over my information as well, but this is our agent service information. So if you have questions, you can definitely reach out to them. If you're not contracted and would like to be contracted, I know Lynn and everyone at GoldenCare would definitely be able to help you with that.
Absolutely. So I'm getting just a little bit of an echo, sorry. I know that there's a comment listed in the questions box, but it was earlier before I realized I was on mute. Sorry about the no audio very, very early on. So if anyone has questions, feel free to type them into the questions box too. We can actually address them live on this presentation. These short-term care insurance policies, they are not as complex as what those traditional long-term care insurance policies are. They're so much easier to learn, so much more affordable, and it really covers the same types of need. So the nursing facility, assisted living facility, these home health care benefits, and in fact, this is one of those unique policies that are built on a home health care chassis. So one of the unique features of this, plus that limited, I can't think of the name of it now.
The limited benefit rider.
Yes, that one. That one. It is definitely a big selling point. And I was thrilled to hear about the upcoming, uh, the expected, or at least hoped for, upcoming launch of about 14 states. I know, we've been waiting, and I knew big things were coming. And I'm sorry, I kept
Yes.
poking, trying to get a
No,
little bit of a a little bit of an idea. But
yes, no, and we are excited as well. And with that limited benefit rider, we've learned, if two people are applying and one is approved and one is turned down, then the
mhm.
other person more than likely is not going to go with this as well because they would like to stay together. They would like to have their policies with the same company. So that's when we were designing these plans. We really wanted to be able to offer something like that for couples so they can have their policies within the same company.
Huge, huge. And GoldenCare, we started out with a very solid position in the long-term care insurance market. So I absolutely agree. Even from a traditional long-term care standpoint, if one person is declined for coverage, you have a very strong potential of losing the sale altogether, because if one person doesn't get the coverage, the other person doesn't want it typically. And I very much agree about the ease of having his and hers, or a couple's policy, written by the same company. So, like I said, this is one of those really big advantages. Um, and also, I'm not sure that I gave you a heads up, but we relaunched our rewards program not that long ago, late December, I want to say. But everyone on this webinar, I want to remind you that this Wellabe product, this STC product, is on our rewards program. So when you write qualifying business with, annualized premium no less than $800, you're going to get GoldenCare reward points. So I just want to reiterate that we're moving into the short-term care market as the solve. Now, there's still a need for the long-term care, but like I said, the short-term care, it fills a lot of those same needs. It's so much more budget friendly, and there's quite a bit more flexibility of what you can do with it. So, I really appreciate you coming on today, Courtney. It's always good to have you. I was on one of the first presentations that you gave on the essential care, learning it myself. So, you gave an excellent presentation, and thank you for sharing the slides. I'll be sure to distribute those to all of those in attendance today. It doesn't look like anyone else typed in questions, so I know when our marketers call following up, we'll be sure to check to see if there's questions then as well. So good
Yes,
deal.
thank you for having me. And, if there's anything that I can help from my side, please just let me know. But I just appreciate everybody at Golden Care and the partnership that we have. We really value that here on our side as well.
Oh, absolutely. We definitely appreciate the partnership again. But before we go, actually, there was a question submitted. What states, is the STC product available in? So,
I can go
okay,
back to that slide. That might be more helpful than me trying to, because it's right
yeah,
there. So
listing
right
them off.
now, we have it in the 10 states, but again, by the end of quarter 1, we should be announcing more states. About 14 states is what the plan is, what the fingers are crossed for, that we should be launching in those 14 states. And once I know anything on the exact dates for that, I will definitely let Lynn know so that way she can get that out to you guys. And
Perfect. Yeah, hopefully the fingers crossed, because state departments of insurance, they don't always They don't always do what we anticipate.
Right, that, yes.
So fingers crossed, fingers crossed. Okay, well, good deal. We are looking forward to some exciting things to come. And hopefully, if that end of Q1, or yeah, end of Q1 number is met, if launched before then, again, there's a strong incentive taking place too. And like Courtney mentioned, it's likely going to be continuing throughout the year with different incentives moving in and out. So definitely keep your eye on your email. We will definitely be sharing details and the announcement when those additional states go live. Courtney, again, thank you so much for coming on as our guest presenter, for sharing the details about this product, and really being our partner through all of this as we're expanding the short-term care market and footprint. So I appreciate all of your assistance.
Yes, thank you.
All right. Thanks, everyone. I hope you have a good day.
Check out our website, goldencareagent.com, or give us a call at 800-842-7799.